All right, coming at you one more time, Barbary Allen, your Wild and Woolly Wordsmith. BarbaryAllen.wordpress.com, wildandwoollywordsmith.com. It's the 21st installment because I've actually done a couple of them today, making up for missed days. And I'm going to explain those missed days because, as you probably noticed if you're following, which, both of you are, my wife and my buddy, missed a couple of days. Well, things got busy, coronavirus being what it is. And things got a little crazy and a little weird and just, wasn't panic mode, just busy mode. Because it turns out, approximately 14 days ago, not 14 days ago, because today's the 8th of April, my wife was exposed to somebody who, a couple days later, I guess 5 days later, had a positive COVID-19 test result from the local mine in the area. A Sarco mine, who's currently being struck against. So just kind of a, fuck you, Sarco. Apparently she's working, which means I guess she was breaking the strike. The person who had contact with my wife at the Circle K, where my wife is working because she's essential, because it's a Circle K and our town has a Circle K and a Dollar General. So anyway, we got our initial, she found out 5 days later, so she worked the following, 3 out of the next 5 days probably, or 2 out of, let's see, no, I guess, yeah, so she worked at least 1 day post exposure, maybe 5 days post exposure. So I can't recall her exact schedule. Point is, it's been 14 days since exposure now, or tomorrow will be. So, but yeah, like I say, we didn't know till 6 days in. So we've known for 7 days. Tomorrow's the 8th, I think, and that's part of why I had a couple of missed days in there on my posts, because I was still trying to wrap my head around what I was going to say in the post, because we don't know much. Because this is Arizona, there are no tests available. So, though my wife did have a fever 1 day, it was intermittent, it went away. The second day she got a raised temperature, but not exactly the 100.4 they were looking for. She has had other symptoms, but it's also allergy season here in Arizona, and we both also have medical marijuana cards, so coughing doesn't mean a lot all the time. But anyway, so 8 days ago, we found out that, so me and my kids having had full contact with our wife at home, we live in the same space. We can't not be within 6 feet of each other. And as I said before, we've been semi-quarantine locked down for, over a month now. So, we were just holding tight and hoping for the best, hoping my wife wasn't going to get infected. And unfortunately, she wasn't wearing a face mask yet because, even though I had wondered about their reasoning behind talking people out of face masks, they weren't wearing them yet. My wife went ahead and started wearing one. Actually had started wearing one before she found out about her contact with the positive test, but not long enough before because she hadn't been wearing it when she'd had contact. Anyhow, so she goes to her manager with it the next morning. Again, she's already worked 4 days hot, asked if she should be quarantined. Manager says no. She works the next night. Comes home the next morning after work, and that's when she ran the fever, sent it to her boss, and told her that she should probably be quarantined, and, reminded her that she had already been exposed. And, because, she worked 1 day hotter, and then she had a couple days off, and then she worked her graveyard shift, and then, so anyway, she, quit going to work this last Thursday, I guess. But turns out things, even though she told her manager immediately, and she was supposed to go, get some information from her manager was supposed to take it to the district manager. It didn't seem to go uphill, or if it did, it stopped there. Because when somebody from Human Resources finally spoke to my wife, yesterday, I guess, 2 days before her 14-day quarantine will pretty much be up and she could probably go back to work, he was blown away that she was actually made to work. So her managers may be in some deep kimchi here because they shouldn't have had her work at all after having been tested, or not tested positive, but having been exposed to someone, and that they probably should have gone uphill with it. I'm not sure how much of this is my fault because as soon as my mom was, not my mom, oh my God, stop it. As soon as my wife was exposed to the virus and I realized that Circle K wasn't doing anything, of course, I called in an anonymous tip to Circle K, their customer service. I contacted the mayor to find out what he was doing about the hotspot at Circle K, and the county health department and the local county commissioner, or I can't remember what they call them here in Arizona, but our local county doohickey. And so it's been all passed uphill, and so Circle K finally got on the ball and contacted my wife and told her to not go back to work until she has a doctor's note. But that's the rub. Arizona has no tests. And because she doesn't have a fever and she's not currently feeling like she needs to be hospitalized, she's not prioritized for a test. So we're still trying to figure out, between the doctor's offices and the county health department, who's going to write the letter saying she can go back to work. Because we can't write it. And I know my wife won't feel comfortable. She might feel guilty after 14 days not going to work. So they might be able to guilt her into it, except they're the ones that asked for a letter. So we're still trying to figure out who's going to send a letter off. And apparently Circle K smells a disaster, because they did say that she's going to get paid for the days she missed due to the quarantining, and that he was apologetic that she was made to stay at work. But, I went to get the kids' lunches today, and somebody was arguing about how the people wearing masks and 6-foot distancing wasn't going to do any good because there was a breeze. Just any excuse to not do the right thing, any excuse to not have to be inconvenienced, or make it just barely inconvenient for you to do anything so you don't have to do anything at all. But anyhow, so, I've been having symptoms. I've had shortness of breath, no fever. I'm in the 96 to 97 range for, since we've noticed. So, but I have underlying lung condition. I have chronic bronchitis. I used an e-cigarette for a while and quit doing that because it was just fucking my lungs up. I was one of those people that didn't get hospitalized, but saw the writing on the wall and quit using the damn thing and went back to cigarettes. I know it's not good, but baby steps, man, baby steps. What about Bob? Baby steps. I've quit a lot of things. Cigarettes last on the list, I guess. Hey, all the hard drugs are out, so get off my back. But anyway, so we've been exposed, and it's been kind of scary. Now, again, we've been wearing our masks when we go out. So if we don't have to be, at least we don't have to feel guilty about passing it on because we were being ignorant. We might still pass it on, but it won't be because we were ignorant. And speaking of passing it on, I'm hearing now that California is concerned. They're starting to do some testing and some correlating. They think they might have had some positive COVID-19s there late November, early December, before China admitted there was a problem at all. Because what they're finding is in California, they do not have a mortality rate that they're having in other states. That it almost looks like there is a herd immunity already established in some parts of California. And they did have an early flu season. It kicked off a little early back in November. So might be that COVID-19 hit California first, and that's why it's not having the death rate. Scary thought. I was looking at some projections, and I know California's got to have at least 10 times, or at least 8 times, if not 10 or 15 times the population of Arizona. They're projected to have 1,200 deaths. Arizona's projected to have 775. Now that tells you, maybe there is some of that herd immunity involved there, but it also tells you that Arizona is not doing a damn thing to bend the curve, because to have only 25% less deaths in the state of California, when California has so much more exposure, so many more actual cities. I mean, we have one big city in Arizona. But they're projecting 775 deaths, and it shouldn't be that high. And the sad part is it's probably going to be higher than 775 when all is said and done, because, as I said, I went down to get lunches for the kids today, and people were ready to just quit trying it all because there was a breeze. Dumbasses. All right, Walden Willie Wordsmith checking out on this longer than usual post, but as I said, we are doubled down on our quarantine, and because, my wife has been exposed, and me and the kids have then just been secondarily been exposed through her. And if we all had mild cases in the middle of allergy season, we really have no way of knowing if we've had it, if we have it now, or if it never got here at all. WaldenWillowWordsmith.com, BarbaraAllen.wordpress.com. See ya.